Hello, my name is Dr. Pallab Majumder. I'm a child psychiatrist. I'm going to talk to you about self-harm.
What is self-harm?
Self-harm is a term which is used when someone deliberately or intentionally harms themselves um, by either self-poisoning or injuring themselves, or maybe punching the wall or pulling out their hair, burning or hurting themselves or strangulating themselves. It's usually a sign of quite serious emotional distress, usually caused by some underlying internal or external factors.
What are these underlying factors that lead young people to self-harm?
What are the underlying factors that lead young people to self-harm? Young people self-harm because of different reasons. Underlying reasons could be relationship problems, feeling bad about themselves when young people have issues with their self-esteem. If there are experiences of past abuse or neglect, that can lead to self-harm. If there is an underlying mental illness like depression, if the young person feels not listened to, feels hopeless about his future, feels powerless, lonely, isolated, or as if he is losing control, all these things can lead to a young person harming himself.
What do young people say about why they harm themselves?
Different people say different things about why the self-harm. Some young people say the self-harm because when they're really struggling to deal with their internal difficult emotions, difficult feelings. Some young people self-harm when they feel as if they are losing control over their lives. The situation is so desperate that they can't think of a way out of that. And self-harming can give them a feeling of control, reduces the feeling of loss of control. Some young people self-harm to release tension. When emotions like frustration or anger builds up inside them, they want to release that. And self-harm can be a release of those pent-up emotions. Some young people self-harm to punish themselves. If they're tormented by difficult emotions like shame and guilt, they sometimes like to punish themselves. Difficult emotions like shame and guilt sometimes are associated with past experiences of abuse or trauma, or neglect or feeling rejected. Young people sometimes find those memories too upsetting to remember, so they try to dissociate themselves from those memories. And when they do that, they feel dead or numb inside, and harming themselves can be a way of feeling alive again when they feel dead inside. However, some young people, a significant proportion of them, can self-harm to actually end their lives. Their situation can be so desperate that they feel that there is no other way out of the situation than to kill themselves. If that is the case, there can be sometimes underlying depression or any other mental illness which is actually leading to such suicide attempts.
How do we know if the risk is high?
The risk of repeated self-harm in young people can be high if there are significant and long-standing experiences of abuse, neglect, or bullying at home or in the school. If they're suffering from depression or any other mental illness, that can lead to young people harming themselves quite repeatedly. If young people are resorting to alcohol or illicit substances to cope with their distress, it has been seen that they end up self-harming even more. The risk of suicide in young people can be high if they're suffering from depression or another serious mental illness. If they are feeling hopeless about the future, if there is not enough social support or way out of the current life circumstances, if the young person is taking too much alcohol or substance again to cope with their difficult emotions, if the young people are planning or had made a quite elaborate plan to end their lives, or have taken measures so that nobody can save them, and then they make sure that their suicide attempt is successful. If there are history of them attempting suicide in the past, if there is a family member or a friend who have also attempted or committed suicide in the past, all these things increase the young person's risk of attempting suicide or committing suicide.